Good afternoon. I'm Greg Hart, Chair of the Santa Barbara County Board of Supervisors. This press conference is broadcasting on County TV Channel 20 and the county's YouTube page. The meeting's being interpreted in American Sign Language by Julia Townsend. Carlos Saracedo is interpreting the press conference in Spanish. His interpretation will be available on the county's website and YouTube page shortly after we conclude the press conference. Right now, we're experiencing the most significant wave of COVID-19 infections to date. While a safe and effective vaccine is now available and is being produced, shipped, and distributed as fast as possible, the dramatic surge in infections throughout California continues. Hospitalizations and deaths around the country, and particularly in Southern California, are at levels not yet seen in this pandemic. Hospital capacity in Southern California is being stretched past the breaking point. Yesterday was the first time we had over 100 COVID-19 patients hospitalized in Santa Barbara County since the pandemic began in March. Yesterday, Governor Newsom indicated the regional stay-home orders could be extended beyond the original 3 weeks. The state is considering lengthening the stay-home order because the infection curve has not been flattened sufficiently to preserve hospital capacity. Health and Human Services Secretary Dr. Mark Ghaly said state health officials will make a decision on whether to lengthen the Southern California orders this weekend or early next week. Dr. Ghaly noted the state will be projecting ICU capacity ahead 4 weeks to January 25th to determine the next course. All regions in California, except for the sparsely populated farthest north region, are now under stay-home orders. Today, the state's overall available ICU capacity is down to just 1.4%. California is now in the worst surge of the pandemic, with the positivity rate reaching 13.3%. For comparison, during the summer surge, the state positivity rate peaked at 7.6%. Our public health experts believe that this latest increase in cases is significantly driven by gatherings that took place during the Thanksgiving holiday. Not only are some people who attended gatherings testing positive, but their contacts and the contacts of their contacts are testing positive as well. This is an urgent reminder of the importance of avoiding physical gatherings during the winter holidays. I know that all of us want to see our loved ones in person, but it is not safe for us to get together with people who live outside of our households at this time. I want to take this opportunity to again thank all the dedicated and committed frontline medical staff and first responders who will be working selflessly through the holidays to keep us all safe and secure. I encourage all of us to express thanks to our friends and neighbors who work in grocery stores, restaurants, and other local businesses who are continuing to keep food and products on the shelves, who are cooking hot meals, and are open for business despite overwhelming hardships and personal sacrifices. Fortunately, both houses of Congress have now passed a $900 billion pandemic relief bill that includes enhanced unemployment benefits and direct cash payments. This economic stimulus package includes critically needed financial support for local businesses and individuals who are suffering from the economic consequences of the pandemic. While this compromise legislation does not go far enough to protect all vulnerable Americans, it is a start, and I am hopeful the new administration will be able to build upon this bipartisan effort to craft a more comprehensive assistance package early next year. I deeply appreciate Congressman Carvajal's leadership as a member of the Problem Solvers Caucus to push aggressively for this much-needed action. The package would send direct stimulus payments of $600 to individuals that could begin to arrive as soon as next week to provide much-needed relief to families struggling through the holidays. Under the new deal, federal unemployment assistance of $300 a week would continue for 11 more weeks from the end of December through March 14th. The agreement also calls for extensions of 2 other pandemic unemployment programs that were created in the CARES Act in March. Both are currently set to expire at the end of this week, affecting an estimated 12 million people. The Pandemic Unemployment Assistance Program expands jobless benefits to gig workers, freelancers, independent contractors, and the self-employed affected by the coronavirus. The Pandemic Emergency Unemployment Compensation Program provides an additional 13 weeks of payments to those who exhaust their regular state benefits. The new COVID-19 economic stimulus package would also reopen the Paycheck Protection Program so that some of the hardest hit small businesses can reapply. The bill would also create a $15 billion grant program for live venues, theaters, and museum operators that have lost at least 25% of their revenues this year. The legislation would provide $82 billion in aid for K-12 schools and colleges, and an additional $10 billion is included to support child care providers that have struggled because of the pandemic. I also want to encourage small businesses in the county unincorporated area to apply for assistance from the Santa Barbara Better Together Fund. Grants of up to $7,500 are available to local businesses to pay for many COVID-19 related expenses. Please apply before December 31st. For more information on our local economic recovery efforts, please visit recoverysbc.org. As we continue through the holiday season and into the new year, please continue to practice these 3 simple personal steps every day. These steps have not changed since the very first days of the pandemic, but are even more important today than the first day I said them. Number 1, remember to wear a face covering and stay at least 6 feet away from other people. Number 2, wash your hands thoroughly and often. Don't touch your face and disinfect surfaces. Number 3, if you feel sick, stay home, don't go to work and isolate yourself. Call your doctor or clinic and follow their medical advice. I'd now like to introduce Dr. Henning Unzarg, the county's public health officer.
Thank you, Supervisor Hart. Good afternoon, everyone. What an incredibly disruptive and at times strange and often painful year this has been. We continue to see an unprecedented surge of COVID cases in Santa Barbara County, as well as in the state. We had 199 new positive cases reported today alone. The hospital admissions have been higher than ever, with now 102 patients, 21 of whom are in the ICU. Santa Barbara County has a very high transmission rate of the virus, represented by a case rate per 100,000 of 32.9 and a test positivity rate of 8.2%. Just to put these numbers in perspective, we now have 10 times as many currently infectious people in the county compared to early November. The major surge in cases and hospitalizations is a direct consequence of people moving around, mixing and mingling, and unknowingly spreading the virus in an accelerated fashion due to the high rate of infected people in our area. Fortunately, our local ICU capacity is still well above 30%, as opposed to the rest of the state, where it is dismally low. Mask wearing and social distancing remain our best protections against getting infected. Our glimmer of hope for going forward are the 2 new available vaccines. We are receiving regular shipments now and are constantly fine-tuning our prioritization list for eligible vaccine recipients to make sure the vaccine is offered in a transparent, fair, and equitable manner. I am pleased to announce that our public health PODs, or point of dispensing places, will start administering vaccine to emergency medical service staff and dialysis staff in the first week of January. We will later continue to offer immunization at multiple PODs to outpatient clinic staff and essential workers. Our hospitals, as well as some larger outpatient clinic systems like Sansom Clinic, Public Health County Clinics, the Neighborhood Clinic System, or the Central Coast Health Clinics, will be receiving vaccine to help with the large task of offering immunization to their staff and patients. Please check our website regularly for vaccination updates at publichealthsbc.org. There has been some concern with the advent of mutated strains of the SARS-CoV-2 virus in England and South Africa. At this point, scientists, as well as the vaccine makers, Pfizer and Moderna, are evaluating this mutation for its potential to evade the new vaccine. Fortunately, so far we do not have any evidence that this is the case. which means the vaccine should work on these mutations as well. It is common for viruses to mutate, usually giving new strains the ability to spread more easily. We will continue to monitor the situation closely and provide you with important updates as we learn more. Please avoid all risky behavior, like travel or mixing with people outside of your household at this time. The risk of getting infected is very high. Happy holidays to everyone, and thank you for your cooperation.
Thank you, Dr. Anzorg. Suzanne Grimacy from the Department of Behavioral Wellness is also here with us today to share an important message about mental wellness.
Thank you. Excuse me. Thank you, Supervisor Hart. Along with all of the other impacts that COVID-19 has created, there is a rising concern about the impact that the pandemic is having on the mental health of many people. This has been documented by the Center for Disease Control as well as many other sources. It's true that we can still connect with others via Zoom and via the phone, but it's still the case that those natural built-in supports that we're used to are not there the way that they were. And now being unable to gather during the holidays is making this even more difficult. Many have described seeing family members, friends, coworkers, or loved ones struggling with suspected mental health needs, but not knowing what to do or how to talk to them. I'd like to speak to a few things today. First, what to do when you suspect another is struggling with mental health needs. And second, ways to navigate the holidays this year and to keep ourselves mentally healthy. First, what can a person do when you see a loved one that looks like they're struggling with mental health needs? 5 things. 1 is to ask questions and really listen. Even if you can't physically interact with someone, you can still observe signs and signals to how they're doing from phone conversations, from Zooming, from texts, all the safe ways to communicate. And they can provide a lot of insights. Just through conversational questions, checking in to see if people are following their normal routines, if they're eating, if they're sleeping, if they're getting outdoors. A lot of information can be gained this way, and if your outreach efforts are being ignored, or if the person has changed their way of communicating or isolating from their communication, those could all be signs that more help is needed. 2 is to normalize conversations about mental health. Right now, after several months of the pandemic, pretty much everyone is feeling stressed out and burnt out. Our mental health is of no lesser importance than our physical health. If issues are shared by a person, affirm the person's feelings, ask how you can help, and follow up in a few days to see if things have improved or not. Don't hesitate to follow up with phone calls or with texts to express your concern. Knowing that you care and that you're really listening to what they're telling you is critical. Be sure to really listen and to avoid the urge of trying to fix things, and know that sometimes just listening is the solution. 3, do ask about concerns for self-harm or suicide. It's a myth that asking a person directly about their thoughts of self-harm or suicide can create a risk. In fact, especially so if you say, I'm concerned about you, I want to make sure that you're doing okay, it's actually a signal to the person that you really care and that you're someone that they can turn to for support. It's also helpful to share with them why you're feeling concerned. 4 is be informed on how you can help. If someone has shared with you that they're not okay, affirm and validate what they're sharing. You can also thank them for opening up and for trusting you as a person that they can share with. You can commend them on their courage for sharing their struggles. It's important that you do not promise to keep statements about suicide or self-harm a secret, even if it makes them angry. At this point, you'll want to connect them with a mental health professional. The Santa Barbara County Department of Behavioral Wellness 24/7 access line is available by calling 1-888-868-1649. You should continue to provide support and encouragement to a person sharing these kinds of thoughts. If you live with them, and if you're concerned about thoughts of self-harm or suicide, remove access to any weapons or other potentially harmful things. Help them to focus on feeling better through short-term solutions, maybe planning the next time you'll Zoom together with family, taking a walk outside, being proactive about scheduling times that you'll talk with them and check in. And lastly, fifth, consistency matters. Follow up and stay connected with people you have a concern about. Even if you can't physically be with someone who's having a hard time, there are ways to remind them that they still have strong connections and people that care for them. Continue to schedule regular check-ins by Zoom or phone or text, and consider offering support in spontaneous ways, sending a text that's not expected, sending a card, dropping off a small gift, letting them know that you're thinking about them. I've talked to some people who are making lists right now about the people that they want to stay in touch with and that they also know will be there to support them in return. There are certain things that as a loved one, you can say to someone that even therapists and mental health professionals can't or don't say. Things like, no matter what, I will always be here for you. You mean so much to me. I love you. These are life-saving words that only loved ones can say that are incredibly connecting and powerful, that can make people who are feeling desperate or alone feel better. It will be especially important this season to take extra steps that focus on our own mental health and the mental wellness of others, and focusing and keeping in mind the things that we can do. Saying no to gatherings with family and loved ones this year is so hard. For those who still may be debating if or how they will say no or make this decision, it's not too late to cancel. Our numbers of positive cases are skyrocketing and continuing to rise. We have all already had to make so many sacrifices due to COVID, but making the hard decision to say no to gatherings is the best way that we can show our love this year for the most important people in our lives. The holidays are not canceled because of COVID, and neither should our hope be. The vaccine is now here in our county. If we continue to support one another, we will make it through this difficult time together, and we will be one step closer to our bigger goal of staying healthy, keeping our loved ones healthy, and eventually returning to life in our community where we are all protected from the virus. Thank you, and warm wishes for a happy and a healthy holiday season. Thank you.
Thank you, Ms. Grimacy. We'll now go to questions from the room. Ms. Lair?
Dr. Anzorg, it was made clear by your office that the two people who died most recently did not have underlying conditions. Can you talk to that?
You know, unfortunately, I don't have any knowledge about their medical history. Sorry, I don't have that information.
On that note, for people with underlying conditions, but they're not in nursing homes, so they're not like second in line to get vaccinated, what do they do?
Well, let me just address this issue of underlying conditions. I feel very uncomfortable with saying, you know, somebody died who had underlying conditions. This underlying condition could be something minor, as the person has a body mass index of 30, which is slightly overweight. You know, we wouldn't necessarily call that an underlying health condition, but that's what could be meant. Or somebody has asthma, you know, and so I'm saying that because my experience has been that many people just dismiss a death if they hear, well, that person had underlying conditions. And I think that is just very unreasonable. We just recently had the first death of a 16-year-old, which is just tragic. So any death is tragic. So that's what I really had to get off my chest with regard to these underlying conditions. I think it's really not been helpful to say that. Excuse me, what was your question actually?
About, you know, you're caring for someone who isn't in a nursing home, but they probably could be, and they're wondering, when do they
Right.
go to the community clinic, and do they have to call their primary care physician? How do they get in line?
Yes, they have to call their primary care physician. Right now, if they are not in a nursing home or in a equivalent to like a long-term care facility. They will not be first in line. However, the next phase, which is going to be decided actually tomorrow by the CDC Council, will include everybody over 75, as well as people between 65 and 75 who have certain health conditions like chronic lung disease or cancer or diabetes or chronic heart disease or weakened immune system for some other reason. So those people will be next in line after all the acute care and the nursing home. So it should not be that far away, really. So I encourage everybody to really check on our website where we announce our immunization activities, but also check with your primary care provider. I anticipate that the earliest that this can happen will be probably in the latter part of January.
And lastly, could I just find out, is this variant possibly here that's in the UK?
Extremely unlikely. However, it is quite an undertaking to check the virus, every virus on their genome. So that has to be done in specialty labs, and it is being done, but it's not widespread, fortunately. But it's only a matter of time that it comes here as well.
Thank you, Ms. Lair. We'll next answer questions on the phone.
Yes, first up is Laura Place with Santa Maria Times. Laura, go ahead.
Hi, everyone. My first question is for Dr. Ansorg in response to your clarification about underlying conditions that you just gave. So, I'm curious then, when a death is announced in the county as a result of COVID, do you see any merit in even including that they had an underlying condition? Or do you think there's maybe a different way county public health could present that, maybe clarifying the severity of the condition, or is there a different way that the county could share that information that communicates, just the severity of the illness and whether that contributed to their death?
Yeah, it's an internal discussion that we keep having. There are two schools of thought, so to speak, about the privacy issues. If you follow the HIPAA or a different guideline for personal privacy issues, we don't want to share too much specifics about a person's medical history, because when we disclose where the patient has died or where they are from, it is possible that that can be, the person could be identified fairly easily. So we are very careful in disclosing too much, and that was why in the beginning we used this term underlying condition, which I really detest, as you may have noticed. And but I don't know how to better inform the public. We have seen our fair share of patients who had really minor health issues or none at all, who succumbed to COVID or who were hospitalized for quite a while and then got better, fortunately. So it is all across the board. And obviously, elderly and people who have a weak immune system and are generally frail will have much worse outcomes from any kind of infection. I hope this answers your question, but it's not a very easy answer to give, because there are real privacy issues here that have to be, we have to respect our patients as well.
Okay, so it sounds like there's discussions internally, though.
Yes.
Maybe within the county department about how to address that.
Definitely,
Okay.
yes.
Okay, great. Thank you for expanding on that. And then my other question has to do with this topic of ICU capacity, particularly in our county. I'm curious if the capacity that's listed on our, community dashboard, the percent of ICU beds in use, does that include surge, like ICU surge beds that have been added on like throughout the pandemic, or are those kind of separate? Because it sounds like on the state level they talk about how we're at 0% capacity in Southern California, but that there are still surge beds. So can you address that a bit?
Yeah, it's my understanding that these numbers do not include surge beds. They could vary from day to day depending on staffing, ability to staff those beds. A bed, or calling an ICU bed a bed, is really a misnomer. It's like a staffed ability to take care of an ICU person. So there's plenty of furniture and beds and ventilators available, but if you don't have the nurses and the doctors to take care of the patient, it doesn't count. So as far as I know, these numbers do not include the surge beds, but they mean currently staffed beds at our ICUs.
I see. So those surge beds wouldn't be staffed until there was the need for them to be, is what you're saying?
Yeah, my understanding is that to go into a surge mode means that one ICU nurse would have to take care of more patients. And we want to avoid that as much as possible because those frontline workers are stretched to the max already. They're already on, in burnout territory. And we really want to avoid that as much as possible. That's the last resort, that you just add on more patients to a nurse or a team that takes care of currently maybe 3 ICU patients. All of a sudden they have to take care of 4 or 5, and that just is a lot to ask. So I think that's where that's the main difference between surge beds and currently staffed beds.
Okay. And do you have any sense of how many, additional beds there are once you consider surge beds? Not necessarily staffed, because like you said, they're not always staffed right now, but how many extra just beds, I guess, are there beyond the percentage that's presented now?
I'm not exactly sure. I think it depends on how much the hospital is willing or able to really maximize their staffing capacity. And staff is really tough to get by these days because there's so much competition. Everybody needs these highly trained professionals, and across the nation, we're discussing to try and hire people from Australia. So we are really in a dire situation because they are nowhere to be found to hire.
Okay, so at this point, you all can't really keep track of how many surge beds there are?
No, and
Sounds like-
it can really change from day to day. All it takes is one ICU nurse gets sick or something, and the numbers change from day to day. That way, sorry.
Got it. No, that's okay. All right, thank you.
Thank you, Ms. Place.
Next up is Tom Bolton with Newshawk.
Thank you. I had a question. I'm curious, I guess this is for Dr. Ansorg. What's the latest from the state regarding the request to create a separate tri-counties region as opposed to being part of the SoCal region?
The state has reached out to our elected officials, so I defer the question to our Supervisor Hart.
We met via Zoom with Dr. Mark Galley a couple of days ago and discussed our request, and he was encouraging, but I think in light of the surge in cases and the decrease in regional ICU capacity and the state contemplating extending the stay-home order, what we were proposing was an exit strategy after that stay-home order would expire. And at this point, it does not appear as though that is as likely to happen soon as we had originally hoped. So I think that actually gives us more time to work with the state on trying to create this new Central Coast region that would be a pathway for Santa Barbara, Ventura, and San Luis Obispo counties to be able to get out of the stay-home order based on our own ICU capacity availability when that opportunity presents itself. But as Dr. Galley said a couple days ago, he's taking our request seriously and is going to continue discussions with us, but there has been no decision made at this time.
Okay, Greg, so that was basically what you told us on Friday. Was that the conversation that you were referencing then?
Yes.
Has there been any additional conversations with state officials?
There has not.
Okay. And a quick question for Dr. Ansorg, following up on Laura Place's question. when you look at these cases of where people have passed away who had quote unquote underlying conditions, can you just give us some sense? I mean, how many of those might have, percentage wise, might have been, truly minor things like, mild obesity as opposed to more serious, immunity types of conditions?
I would have to get back to you about that. I'm not informed enough to give you an exact number, but I'm happy to look into that.
Yeah, I think it would be helpful for the point you made that, people think of, underlying conditions as somebody who's, almost gonna die anyway, as opposed to, like you say, somebody who may have a very mild. And I think knowing sort of the breakdown would be helpful. So if you could provide that, we would appreciate it.
Yeah, I agree. I'm happy to.
Okay, thank you very much.
Thank you, Mr. Bolton.
And that concludes our questions.
Thank you for those questions. This is the 75th press conference that we've held since the beginning of the pandemic in March. This may be the last press conference, this will be the last press conference in this format during my term as chair of the Santa Barbara County Board of Supervisors. A lot has happened this year and that I never could have imagined when I took the gavel in January. Early next year, our new Board of Supervisors colleague, Bob Nelson, will be sworn in as 4th District Supervisor and Chair of the Board. I'm deeply honored to have had this opportunity to serve my community during this very difficult time. While my year as chair of the board is almost complete, I look forward to continuing my service for the residents of the 2nd District and the people of Santa Barbara County. I want to thank my Board of Supervisor colleagues for their support and encouragement this year. Supervisors Doss Williams, Joan Hartman, Peter Adam, who will be retiring for public service at the end of the year, and Supervisor Steve Lavanino. I want to recognize Mona Miyasato, the county CEO, for her steady and confidence-inspiring leadership during this most difficult time, along with the county's entire executive team. Thank you to every member of the county staff family, in particular the Public Health Department team led by Dr. Do Reynoso. I'm also especially grateful to the people in this room who've made these broadcasts possible. There is so much cynicism about government in our country right now. I want you to know the people who are in the trenches of local government are here for the right reasons and do incredible work with passion and commitment. Finally, I also want to thank the local media. It would not have been possible to keep county residents informed with the information required to save lives without the hardworking women and men in local journalism. They have been among the most essential of all workers during this pandemic, and I deeply appreciate the dedication and commitment you bring to your jobs every day. Please support local journalism in any way you can, because democracy will not survive without a free press. The Public Health Department will publish a press release next Wednesday that will be posted on the county's publichealthsbc.org website. The county's data dashboard will continue to be updated through Thursday of this week and will resume daily posting of information on Monday, December 28th. The new Zoom format press conferences will resume on Tuesday, January 5th, and Friday, January 8th, and every Friday at 4:30 p.m. We are stronger safely apart. Please take care of your loved ones during this holiday season.